What if one of the most aggressive growth pathways in breast cancer could be shut down right at its source? Today, we're exploring how cutting-edge drugs targeting the PI3 kinase pathway are doing just that, offering new options, renewed hope, and powerful tools for tackling some of the toughest cases of breast cancer.
Welcome to Cancer Treatment Updates, where treatment options for cancer are discussed openly and demystified.
Today, we are exploring a fascinating area of cancer research that's transforming the way we approach breast cancer treatment: the use of therapies targeting the PI3 kinase pathways. These innovative drugs are reshaping the landscape for certain breast cancer subtypes, offering new hope to patients. Let's embark on this enlightening journey to understand how PI3 kinase pathway inhibitors, including Alpelisib, Inavolisib, and Capivasertib, are impacting breast cancer management. Understanding the PI3 kinase pathway and PIK3CA mutations are at the core of this discussion. The PI3 kinase pathway is a sophisticated cellular process that regulates critical functions like cell growth and programmed cell death, also known as apoptosis. In many breast cancer cases, this pathway becomes disrupted due to genetic mutations, particularly in the PIK3CA gene. Fascinatingly, up to 40% of primary breast tumors may show such mutations, highlighting the substantial role of PI3 kinase signaling in breast cancer dynamics. The PI3 kinase mutations, or PIK3CA mutations, often occur in two key regions of the gene, the helical domain and the kinase domain. These changes result in hyperactivation of the PI3 kinase pathway, giving cancer cells a relentless drive to grow while sidestepping the normal safety checks that typically regulate cells' life cycles. This uncontrolled growth not only propels tumor development but also contributes to resistance against some standard treatments, making these mutations prime targets for therapeutic intervention. In terms of clinical application, the approval of the first PI3 kinase inhibitor for breast cancer in 2019 was a groundbreaking achievement. Alpelisib, marketed as Piqray, led the way, receiving approval for treating hormone receptor-positive, HER2-negative advanced breast cancer patients with PIK3CA mutations. Fast forward to today, and we now have more agents, more treatments expanding this category of therapeutics. Inavolisib recently joined the therapeutic arsenal, designed to target PI3 kinase alpha isoform with refined precision. Meanwhile, Capivasertib represents another exciting development, though it operates a little differently. It targets AKT, a critical protein downstream from the PI3 kinase pathway, disrupting the same survival signals that cancer cells exploit. While their mechanism varies slightly, all these drugs aim to shut down the critical growth and survival pathways hijacked by breast cancer cells. The role of biomarker testing is extremely important. The pathway to using PI3 kinase targeted therapies begins with biomarker testing. Precision medicine demands that patients undergo testing for mutations in PIK3CA, AKT, and PTEN, genes that influence the PI3 kinase AKT pathway. These insights help oncologists select the right therapies, ensuring that treatment is not just based on tumor type, but on tumor biology. Testing can be performed using traditional tissue biopsies or newer liquid biopsies, providing flexibility and speed in identifying actionable mutations. Interestingly, PI3K pathway mutations are particularly common in hormone receptor-positive, HER2-negative tumors, especially in well-differentiated tumors. Understanding the mutation landscape allows clinicians to match patients to therapies more effectively, maximizing the potential for positive outcomes while minimizing unnecessary exposure to ineffective treatments. As with any potent therapy, PI3 kinase pathways inhibitors come with their share of side effects. Alpelisib and Inavolisib can lead to side effects such as hyperglycemia, rash, gastrointestinal disturbances. Fortunately, proactive management strategies such as regular blood sugar monitoring and early dermatologic interventions have been shown to reduce the burden of side effects and support adherence. Capivasertib, targeting the downstream AKT protein, brings its own set of potential challenges, such as fatigue, rash, and occasional nausea. However, because it works downstream, some of its side effects differ slightly from those associated with direct PI3K inhibitors. Navigating these side effects effectively requires close collaboration between patients and their healthcare teams. Striking the right balance between efficacy and tolerability is key to ensuring patients can stay on treatment and reap the maximum benefit. In summary, PI3K pathway inhibitors represent one of the most promising advances in targeted cancer therapy. Whether directly inhibiting PI3K like Alpelisib and Inavolisib, or disrupting the pathway downstream like Capivasertib, these therapies embody the principle of precision medicine, matching the right treatment to the right patient at the right time. As research deepens, these treatments are poised to expand their reach, potentially offering hope to patients across additional breast cancer subtypes and stages, and possibly other tumor types. Thank you for joining us on this journey through the evolving world of cancer therapeutics. Until next time, stay hopeful, stay informed, and stay connected. Thank you.